started your timer and here is your question. This one, once you have read, I'll move on because there are two more slides. Not much information here. Yes?
Yes, madam, I read.
Yes. There is one more slide. Once you've read this, kindly let me know. Yes, next.
Yes, yes.
Okay. Once you are done reading, then we'll begin. Since it's a communication skills session, we'll be given 9 minutes in the resting bay to read and prepare for this session.
Yes.
Okay. If you have read and understood, considering it communication skills session, kindly begin.
Yes, I am Dr. Howard, one of the surgical doctors, CT2, in this South hospital. I want to discuss a case with polytrauma. May I confirm that I am talking with the consultant on? Can I ask your name, please? Hello?
Yes, I'm Dr. Jahan.
Okay, Dr. Jahan, you are consultant on call, and I want to tell you about a patient who came in night with multiple injuries. He is a 20 years old man, and he received injury in road traffic accident. He was unconscious when he came, and I did the examination with my colleague according to airway breathing circulation protocol, ATLS protocol, and I found that he has abdominal pain and tenderness, and he has obvious femoral fracture, and also the wind swellage is also there. And I also found that his GCS is normal at the time of examination. In spite of this, that he came unconscious, and the problem is that his left leg is cold numb, and he has severe pain in the foot when I move it. He is otherwise hemodynamically stable, and his labs are normal, except his C-reactive protein is raised. So I want to discuss this case with you for further management or likely the urgent intervention.
Okay, doctor, what is the most urgent here?
In this case, I think the most urgent problem is his leg problem, because he has pale cold lump, it is pulseless and very severe pain. in spite of this, that he has abdominal problem, and maybe on ultrasound that shows that he has blood collection, maybe there is underlying pathology. But the number one priority is leg problem, which I think that may be a vascular problem. We will investigate.
So you are saying that the patient is having now a pulseless foot.
Yes, yes, he is pulseless.
So could you please tell me what are the causes of pulseless foot?
It may be due to vascular injury, as he has a femoral fracture, and vessel may be injured, maybe femoral artery may be injured. Other causes is that due to injury, artery goes in the spasm, and I cannot palpate it. And otherwise that maybe he develops compartment syndrome of the leg.
Okay, so is the patient is wearing a C collar?
Sorry, it is not mentioned in the notes, and I will check and then let you inform you again.
And what about the patient is rigid or not?
Sorry, it is also not mentioned in the giving notes, and I will check it again and investigate it. Then I will let you know.
So you haven't seen the patient and yet you have called me and telling that it is the most urgent case. Okay, so what is your plans of action right now?
First of all, as I have done the primary survey and secondary survey, and I have diagnosed all these problems in this patient, then I will investigate. I will do the scan head, as the patient was unconscious initially, but at the time of examination, his GCS was 15/15. I will also do the CT scan abdomen, and as well as I will do the abdomen and pelvis, and as well as I will do the duplex scan of the leg to check the vascular status of the patient.
Okay, so what you have to do, you have to inform the orthopedic consultant, just note that down, and the vascular consultant as well, and just inform the operation theater, okay?
Yes, yes, of course, after investigation.
Okay, so what to do before sending him to the theater?
Yes, before sending to the theater, I will call to the anesthetist, and I will inform the orthopedic surgeon and the vascular surgeon for his operation. And I
what is your responsibility? What is your responsibility before sending him to the theater?
I will resuscitate.
How will you prepare the patient?
How I will resuscitate the patient. I will give IV fluids, antibiotic, analgesic. I will reduce his fracture site and give the splintage. I will send the blood for a cross match and arrange the blood, and I will take the consent from the patient, and these and all the informed consultant will be informed.
Okay, don't forget to inform the patient's relatives, okay? And what will you do for the wound?
What do you?
For the
what
wound.
will you do for the wound?
Wound, yes, wound. I will cover the wound. I will do the antiseptic dressing and the wound cover.
Okay, so why are you calling me right now?
I want to, you are on call consultant general surgeon, and I want to inform you before sending this patient to other subspecialties. So it is necessary to inform you, because he has also the abdominal problem and maybe need operation after this vascular and orthopedic surgery.
Okay, how will you fix his fracture and why?
As it is a open fracture, so with the help of the orthopedic surgeon, I will do the wound debridement, clean the wound, any vascular repair will be done. Before vascular repair, I will apply the external fixator in this case.
Why?
To stabilize the fracture site, and then I will repair the vessel.
So why people I may need to call either preoperative or intraoperative. Do you have any idea whom I have to call?
Intraoperative or operative, his relative will call me. I'm sorry.
No, who would you involve in the management of this patient?
Yes, I have told you that I will involve the orthopedic surgeon, vascular surgeon. They both are involved in this case, and I will also inform the patient relative if they are there.
Okay, you have to involve.
Yes, please tell. Yes.
You have to involve the general surgeon also, as
and
the patient
the
is
plastic
having
surgeon. Why?
And the plastic surgeon, yes.
Explain.
As the patient
why.
is having abdominal distension,
yes.
So you have to call neurosurgeon, and as it is a open wound and he has a RTA, so you have to call plastic surgeon also.
I think you are the general surgeon, and
no, I'm not general.
No. You have called the trauma surgeon, trauma consultant.
Yes,
you have to be clear.
Trauma surgeon is not, madam, general surgeon.
No, come on.
No.
There are two different entities. This is the free fluid in the paracolic gutter. So that's why you're doing the ultrasound. You've done the ultrasound. That's why you will be involving the general surgeon and the plastic surgeon. Why would you involve the plastic surgeon?
Because there's an open wound and patient need facial cover or muscle muscle flap cover. So so plastic surgeon is needed in this case.
How would you decide which graft is needed?
Which
graft? Skin graft?
Skin graft in this case, at that time, there is no graft is needed. Because it is open fracture, and I will just do the external fixation.
That's why you'll discuss it with the plastic surgeon.
Plastic surgeon. And then I will discuss with the plastic surgeon.
All right.
After that, we will decide that mostly it is the partial thickness graft is needed.
In the management, what is one thing that you have missed? If you can tell me in one sentence or just one word, please.
Duplex scan I have done. Duplex scan I've mentioned.
Angiogram have you mentioned? Lower limb angiogram. CT angiogram of the lower limb. Have you mentioned that?
No. I didn't mention CT.
Yes, this is something you have to add that you must also do.
Yes, okay, madam. CT angiogram of the lower limb. Yes.
Yes, of the lower limb.
Yes. It is better to perform
CT spine you have to do, CT brain you have to do, you have to update as well on that because you have to...
The whole body CT.
Yes, please.
The whole body CT?
No.
Yes, in case of RTA...
CT chest, there is no need of CT chest, I think. So because patient has no chest injury, so why I will do the CT chest? I will do the CT abdomen and pelvis. I will go very targeted and focused.
Okay.
I will not do
actually, in case of RTA, you cannot say whether the injuries happen or not.
You do the whole body evaluation, and you do
evaluation, but not the CT scan.
It was question in my. It was question in my Gen 9 center. It was a session.
What is the question?
And she asked me that what you want to do, anything else. I didn't have that in mind, but everyone is saying that CT scan of whole body.
Yes, you do evaluate. If not the CT scan, then you do the X-rays first of the whole body, and then depending upon on your first survey, you rule out what injuries are there. Then you do the CT scan. Otherwise, it's like exposure to advanced rays, and then you don't want that. Besides, it's costly as well. So maybe she wanted you to mention. Yes, Dr. Daniel, please.
Okay, ma'am. Good evening.
Good evening. Yes,
please. Yes, I have a query. I want to understand. Do you mean CT scan of the whole body?
No.
Is that what she was saying?
No, she's saying.
Doctor, what were the things you have already told? Can you please tell us? When they asked you what are the things you already told?
Yes, I have told, as far as I remember, that the duplex, the lower limb CT angiogram. I will do the CT of the abdomen and pelvis. I have forgot about the head brain.
CT brain and CT
Maybe.
spine.
Have you talked about X-rays? Have you told about X-rays?
No.
Okay.
No.
In ATLS protocol, you have to do 3 X-rays primarily. That is the X-ray of the cervical spine, X-ray of the chest, and X-ray of the pelvis. I think they were asking about these things.
He was asking about X-rays. Yes, this is what I was telling her.
I think I agree with him.
Yes, I agree with him.
X-ray
And
cervical
bedside
spine,
Doppler. Yes.
chest X-ray and X-ray pelvis. These 3 X-rays are must
Pelvis.
for ATLS protocol primary surgery.
ATLS patient. Okay, okay.
And I think they are called the trauma series.
Yes.
Yes, the trauma series. Yes.
Good.
Okay, sorry. One more thing, ma'am.
Good information.
Yes, please.
Yeah. One more thing. One more thing. I think in this particular station, I think they are supposed to summarize at the end what they discussed with the consultant.
You have to summarize the plan. Not summarize. You have to tell the plan back to the consultant. Everything, all the discussion that has been discussed between the patient, between the consultant and the candidate. That you have to summarize and tell back that what I'll be doing. Yeah.
Okay, thank you.
And this is again the same kind of, the same kind of station that we did yesterday, ISBAR. You have to give information, you have to tell the situation, you have to tell the background, then you have to give the management and the risk. So, yes.
Madam, summarize to trauma surgeon on call or who?
Yes, of course. You're talking to the
trauma surgeon on call.
Yes.
Trauma surgeon. I will summarize again.
Yes, all the plan that you have asked me to check the collar. You've asked me to contact the vascular surgeon. You've asked me to, so everything that has been discussed between you and the consultant, reduce the joint because there was tibiofibular joint fracture. So you have to reduce the fracture, then reassess the leg for the pulses and discuss it with the neurology and then do the Doppler, all the plan that you have gone through, why update about the general surgeon, and then do the CT brain, CT spine, and then you'll do the...
At the end of the session, I will again speak to the trauma surgeon on call, all these things in summarize.
Yes, yes, please.
I want to add something.
Yes, please.
Dr. Khawer, you are telling that I examined. I think it will be wise if you don't use the I or we. Because maybe you weren't the doctor that attended the patient, or you said that it is not in the notes. So it will be wise to say that I'm sorry, I will definitely check and let you know.
Okay.
Okay. And the best way to avoid I is on the examination, it was found or it was discovered or it was, so instead of I, you can use the word it. Or the patient.
And another thing, if the consultant asks you again to tell something again and again, you cannot tell him or her that I have already told you, because you are talking with a consultant. So if he or she asks you again, you have to answer it again and again.
Yes.
Okay, right. That's right.
Yes, good. Thank you.
That's good. Thanks.